Thank you, Mr. Chairman. And this has been a fascinating discussion, and I think very important that we hold this hearing. Obviously, as the chairman has said previously, this is a driver of our healthcare costs that will impact our future expenditures, our future debt. But it's also, and as he's fully aware, it affects so many other areas. It affects the ability for individuals to lift themselves out of poverty by taking a great job. It affects that workforce participation rate that is so critical for us to grow an economy. And it affects the everyday ability of individuals to live their lives to the fullest. And I think, if there's a lot of things we could do for our constituents, but if somehow diabetes could be solved, it would have a dramatic impact, perhaps more impact on our constituents than anything else that we could possibly do. And by the way, the same thing could be said for heart disease, for cancer, and for Alzheimer's. All of these are drivers of all of these conditions, including our expenditures, including the impact on people's lives. And it's been a great discussion. I agree with so much of what has been said here. I agree with Senator Lee that we should create a system that promotes additional private investment, private innovation to help help to develop new solutions for treatment. But I also agree with others who have talked about the government role in this. I've always supported investment in NIH funding, which is very, very important to drive the underlying research and development that leads to some of those innovations. And then, like it or not, I think the government has for a long time been engaged through the choices or the incentives maybe is a better way to put it, the incentives that we've had in the system regarding nutrition, regarding the food that people eat. We've done food pyramids, we've done recommendations, we've done school lunches, recommendations there. And then we've done the SNAP program, the Farm Bill. All of these help to lead to decisions that folks are making about their own lifestyle, about their own nutrition, exercise, and so on. And so we're in this like it or not. And so we ought to be looking not only at the opportunities for additional new treatments that we could help to ensure that the right conditions are there for those to develop, but we ought to be incentivizing the right human behaviors to prevent the disease to the extent that we can, that individuals can prevent it in the first place. So I guess the first question I have, Dr. Herman, I'd like to get your thoughts. We've talked about the link between obesity and diabetes. We've talked about the link from the early 70s of the commoditization of food, the sort of what we have promoted. How much of diabetes is related to these lifestyle choices that individuals make? If you had, just imagine for a minute that people are eating healthily, they're exercising, they're doing the things that we know are good lifestyle choices. How much of diabetes would we do away with if that were the case?
So thank you for the question. It's really an excellent question. It is quite clear that a significant proportion of type 2 diabetes is the direct result of obesity. And it's also clear that some lifestyle choices play into the development of obesity and diabetes in that path. It's hard to quantify how much how much of the lifestyle or which components of lifestyle or other environmental factors are the specific factors that have led to this epidemic. So there's a tremendous amount of controversy around what are the specific nutritional components or combination of nutrients, or how, or in what fashion are they presented that leads to obesity per se and diabetes. And yet, it's clear that that is a major component.
Sure.
It's hard to nail down an amount.
Sure.
Yeah.
Anybody else want to take a stab at that? I know, President Nygren, you've talked about the importance of programs that encourage good nutritional choices and exercise and so on. Does anybody else want to take a stab at how much we could resolve if people were making the right choices and had access to the right nutrition.
Again, as president, one of the things of the Navajo Nation I've noticed is that, thank you, Congressman, is that when people get out there, I think they're really enjoying these walks and the runs and opportunity to educate themselves on healthy foods, healthy diets, healthy lifestyles. I've seen a lot of people turn around and they tell me, President, this is what I look like a couple of years ago, and now I've been attending these events that are being hosted and sponsored by this program that we're trying to get reauthorized. And really, to me, it helps. It helps dramatically. I don't know the percentage or the numbers, but I think that it's better. It would definitely decrease, and I think overall mental health, depression, diabetes, I think it really just helps the person overall if they can eat healthier and participate and exercise. So I think that in my community, it's really been working. So
Yeah, and I don't know, just go ahead, Ms.
I think that you said a very key thing. I think the availability of healthy food is really a very big key, access. You said that, let's imagine that everybody is eating healthfully, but that's not the case.
Right.
Everyone doesn't have the healthful foods available to them, or they cannot afford the healthful foods that are out there. And I think that that's the key that we have to think about. I think that definitely, as President Nygren was saying, when people are introduced to things and they're introduced to healthier lifestyles and healthier ways, they really do want to take advantage of it. I'm not saying it's 100%, obviously, but I think that for the most part, and those who I've worked with, who I've introduced healthier lifestyles through lifestyle change programs, have embraced it and have made significant changes. But again, it's access.
If I could just follow up on that, I couldn't agree more with that, by the way. And we don't maybe know the exact amount, but the dramatic impact, I think all would agree with that. And so I think this is a wonderful discussion to have in regards to how we can ensure that new treatments are being developed. But I think we need to spend a lot of time figuring out how government programs today are incentivizing bad nutritional choices, and I'm talking about the SNAP program. I'm talking about the Farm Bill. We subsidize a lot of agricultural development as well, a lot of farming, and we ought to be thinking about how we can ensure that we're educating, we're encouraging people to make the right choices, and then access is so critical. And I completely agree. These are discussions that we really should be having to help to ensure that people have access to being able to make the right choices and know what those choices should be. So thank you so much for holding this hearing. It's been a great discussion.
Thank you, Mr. Smucker.